Well, it's really important to consider each patient's capacity for self-care. So, you'll have some patients who they'll take anything on board. Anything you suggest, they will grab it and run with it. and that's great. But most of them will not be there, right? And there are a lot, especially if you've got people who are struggling with chronic conditions or with mental health conditions. It can be, they might be a bit more reticent to start doing some self-care, right? So it's important to start really small. Just give them one simple little thing to do and encourage them to do that. And when I always ask my patients about their self-care. If there's anything they're doing that is positive, encourage that. Tell them that's great that you're doing that and spending that time on yourself. Because I think people need to hear that.
Yeah, we take it for granted, but that might be a big step in somebody's day to actually spend 3 minutes of mindful breathing.
Especially if you have someone, with mental health issues who may have self-esteem issues. The idea of spending time on themselves is very foreign. So, we have to really encourage that. And even if it's something as simple as, they try to spend 10 minutes meditating twice a week, that's great. They're not going to start adding more unless they get some encouragement and positive feedback about it, right?
Yeah, that's a good point. We don't really look at what they're currently doing and supporting them there. And that's the problem we end up giving. Well, we don't, but there are some in our industries, in the healthcare industry, that overload people with too much homework. Mm-hmm. And our lifestyle just doesn't afford more exercise, more homework, really.
It has to be things that are easy enough for them to fit into their routine and things that they will see a benefit from, right? And the same self-care tips aren't going to work for everyone. So that's important too, to emphasize for them that I will sometimes give people a PDF with a number of self-care tips for example, stress management or to help with sleep. And I will always tell them, try different aspects of this on different days, see what resonates with you, see what you feel works best, and then go with that. You don't have to spend an hour doing self-shiatsu. If you want to, that's great, but...